Engaging youth in tracking local climate-related health risks is not just an educational exercise, it is an urgent strategy for building community resilience and preparing the next generation to confront the accelerating impacts of a warming world. Ocean-driven climate change, rising air temperatures, and extreme weather events increasingly threaten human health, manifesting as heat-related illnesses, water contamination, food insecurity, and infectious disease outbreaks. Young people, when empowered with the right tools and guidance, can play a pivotal role in monitoring these threats, collecting data, and raising awareness, while simultaneously developing scientific literacy and a sense of civic responsibility. The stakes are high. Without active engagement and early detection at the local level, communities risk delayed responses, preventable illness, and cumulative health crises that disproportionately affect vulnerable populations. Youth projects can take many forms, from structured school-based programs to community-driven initiatives. Students can learn to measure ambient temperatures in neighborhoods, track humidity and heat index patterns, and observe urban heat islands in real time. These activities help identify areas where residents are most exposed, such as densely built neighborhoods with little vegetation, poorly ventilated housing, or streets without shading. By systematically recording data and comparing it to historical norms, students can detect emerging heat trends and communicate these findings to local authorities, community organizations, or health clinics. This early warning function is critical, especially in regions where meteorological monitoring is sparse or delayed, and can directly contribute to preventing heat-related illnesses and hospitalizations. Water monitoring is another key area for youth engagement. Students can collect and test water samples from local rivers, wells, and reservoirs to detect changes in quality that may precede outbreaks of waterborne disease. Tracking indicators such as turbidity, bacterial contamination, or unusual algal growth can provide valuable insights into environmental conditions that affect human health. In coastal areas, monitoring for harmful algal blooms, Vibrio bacteria, or temperature anomalies can inform both local fishing practices and public health advisories. Engaging youth in these tasks not only contributes data that might otherwise be unavailable, but also fosters environmental stewardship and awareness of the links between ocean heat, water quality, and disease risk. Disease surveillance is an extension of these observational activities. Students can document cases of vector-borne illnesses, track mosquito or tick populations, and note any correlations with local weather conditions, standing water, or temperature spikes. By collaborating with local health authorities, these citizen science observations can complement formal epidemiological data, providing a more granular, real-time picture of disease emergence. Such involvement emphasizes the human consequences of climate change, making the threat tangible and motivating preventive behaviors such as mosquito control, safe water practices, and community alert systems. In addition to data collection, youth projects can emphasize community outreach and education. Students can design awareness campaigns to share heatwave safety tips, hydration strategies, or guidance on safe food and water practices. They can partner with local clinics, schools, and social organizations to distribute information, conduct workshops, or help implement early warning notification systems. This dual focus, both monitoring and action, ensures that youth engagement moves beyond observation and translates into tangible health benefits for their communities. However, the potential for meaningful impact comes with responsibility. Inadequate training, inconsistent data collection, or miscommunication can undermine efforts and even create false security. Programs must ensure students receive proper guidance, safety protocols, and scientific supervision. They must also be mindful of vulnerable populations. The elderly, young children, and people with chronic illnesses are most at risk during heat waves and water contamination events, and youth-led initiatives should be designed to complement, not replace, professional public health interventions. Without careful planning, the enthusiasm of young participants could be misdirected or underutilized. Despite these challenges, the benefits of youth engagement are substantial and multi-layered. Students gain scientific literacy, critical thinking skills, and a deeper understanding of the complex links between climate, ocean health, and human well-being. Communities gain valuable observational data, increased awareness of localized risks, and enhanced social cohesion as neighbors become aware of emerging threats. Early identification of high-risk areas allows health authorities to prioritize interventions, preposition resources, and conduct timely outreach, potentially saving lives during sudden heat waves, floods, or disease outbreaks. Importantly, youth projects instill a sense of urgency and responsibility that extends beyond individual communities. As students witness the tangible consequences of ocean-driven warming, rising temperatures, water contamination, and local disease outbreaks, they become advocates for broader climate action, public health preparedness, and equitable adaptation measures. This awareness is critical. Climate-driven health risks are not evenly distributed, and those least able to respond are often the most exposed. By actively involving youth, society can cultivate informed citizens capable of both monitoring and influencing the policies, practices, and behaviors needed to reduce preventable suffering. The warning is clear. Without early, localized monitoring, communities remain reactive, responding to heat, water, and disease crises only after harm has occurred. Youth-led projects provide a proactive, grassroots approach to surveillance, education, and resilience building, but they require coordination with schools, public health agencies, and community organizations to be effective. If properly supported, these initiatives can reduce preventable illness, strengthen social cohesion, and provide a model for participatory climate health action that grows in sophistication and impact as the urgency of ocean-driven warming increases. In a world where climate shocks are accelerating, empowering students to track, report, and respond to local health risks is both a practical necessity and a moral imperative for safeguarding communities today and in the decades to come.